generally, what I like to do, if it's a new patient, a teenager, someone who is not really used to kind of a high-end type of skincare, you know, getting all the information from them, and I really like to start them off with, you know, a glycolic peel. Excuse me. And glycolics are, you know, they're derived from sugar cane. They're sugar-based acids, and it's not very aggressive because you have to kind of build into those types of peels.
That
but in
sounds
the
a
long
lot,
run, yeah, and in the long run, you know, we want to kind of work those patients up to a different level of peel.
So you're going to salicylic peels, which that's just from tree bark, basically.
Yes, it is. Mm-hmm.
And it's a similar ingredient to what's in aspirin. So
it is.
I think that's really important for people to understand that, hey, if someone says, hey, you're doing a chemical peel, you know, and to know that, you know, this word chemical is, you know, kind of a scary word, and they really don't need to be afraid of that. The important thing, I think, is that they're in the hands of somebody who knows what they're doing, somebody like you with lots of experience.
And in our clinic, I believe that the more comfortable a patient is, the more apt that they're going to relax and not see it as such a scary treatment, but more of a relaxing experience. And you know, many times I do have people just, it's a recliner, and they're laying down. They generally have a nice blanket on them because, you know, when you're warm, you kind of tend to relax, and you know, you have the music. It's kind of spa clinical.
That sounds really comfortable. Like I might like take a nap or something while you're.
They will snore, go sideways, and
you're making me a little sleepy there. I'm going, hey, maybe I'll sign up for one of these myself.
Yeah, and you know, it is important to make sure that, you know, your patient or your client, it's about their comfort.
Sure.
100%.
No really known cure for acne. We have a lot of different treatments for it that are better really than they have been at any point in history. But for chemical peels, you know, if you have a patient that comes in and they've got moderate acne, they've got red bumps on their skin, they have little cysts, they have some pustules.